Okay, class, so last week we covered the brachial plexus nerves. This week we're going to go over the peripheral branches of the brachial plexus. Okay, these branches consist of the axillary nerve, radial, ulnar, musculocutaneous, and median nerves. So the first one we cover is the axillary nerve. This, just like the other brachial plexus nerves we went over last week, have sensory, motor, and tests. Sensory innervations of the axillary nerve is the lateral shoulder, right over this area, and in the armpit or axillary patch. The motor is deltoid abduction, so that's bringing your arm out like this, and then the test is you test the deltoid, which you hold your arm out at 90 and push down against it. Okay, musculocutaneous nerve. The sensory innervation is the lateral forearm and hand. So if you're in anatomical position, you're looking at the lateral part of the hand, or along the radial bone. The motor is biceps and elbow flexion. So you're going to bring your arm up and back down. This is flexion. To test this, you're going to test the biceps. So you hold your biceps at 90 degrees and you're pushing down against it. Okay, the radial nerve. The sensory is the dorsal web space between the thumb and index finger. So right here. Right in here. The motor is wrist extension and thumb extension. So wrist extension and then thumb extension. So like you're giving a thumbs up. The test is you're going to test wrist extension. So you're going to bring them in wrist extension. You're going to hold it 5 seconds. These are all break tests. When you're doing the test, they're all break tests. So that test for the nerve, and they're gonna hold it, and you're gonna push down against for 5 seconds in the middle of the movement, the range of motion. Also, the dorsal web space of the thumb and index is the test. So you're gonna hold an OK sign, and you're gonna try and pull them apart. The median nerve, the sensory, is the distal radial aspect of the index finger. So right all along here. Okay. The motor is the thumb pinch. And you want to make sure that both the tops of the fingers touch each other. If not, if it's like over here or off to the side, that's a positive sign for neurological disorder. Opposition of thumb, so you're bringing the thumb over like this, and also abduction of thumb. The test is the thumb pinch, so like the OK sign. And then opposition, so you're going to do the opposition and try and pull them apart. The ulnar nerve, the sensory is the distal ulnar aspect of the little finger, so right here. The motor is abduction of the little finger, so abduction, so come in here. And the test is here, and you're going to try and push them in. Okay, the median nerve and ulnar nerve have a crossover, which the crossover comes down from the elbow, crossover right in about the middle of the forearm. So if you have some median nerve damage, you might also be getting some crossover symptoms into that ulnar nerve. Okay, now we look at sensations of the hand. So we look at the dorsum and the plantar side of the hand, and you see where the different sensations occur at the different nerves. So you see the radial, median, ulnar, and the divisions of them. Okay, so nerve damage and paralysis of these nerves. The ulnar nerve creates like a claw hand. The radial nerve has a wrist drop, so you can't control your wrist and it just hangs there. And the median nerve cannot make the OK sign, so that means not only can you not make and touch tip to tip of the fingers, but you can go to the side or over like this. Okay, so that's it for the peripheral nerves of the brachial plexus. Next week we will go over the lumbar plexus and those peripheral nerves.